All right, cool. So bringing a longevity startup to life means navigating both biology and business. This panel gives the stage to founders forging the future and finding the funding to do it. So let's welcome up our moderator, Sonia Arrison, and our panelists, Mac Davis, Jasmine Smith, and Joe Betts-LaCroix.
Got a packed house tonight.
Is this on? It's on. Okay, great.
Check.
All right. Well, we're going to wake you guys all up from lunch, right? Our spicy panel. What? Joe, you need to wake up. Okay, startup stories. So I know that Jasmine and Mac have already been up here, but probably some of you were out in the hallway and did not hear what they were saying, and we're going to have some different questions anyway. So, since this is about startup stories, I thought instead of going and introducing each of them, I'd let each of them say something about not only what is it that you do, what does your company do, and why did you get interested in the first place? Like why is this of interest to you, and why should everybody else be interested in it as well? Why don't we start with Jasmine?
Hi, I'm Jasmine, CEO and co-founder of Rejuve AI. And what I describe it as is a decentralized longevity research network. And that pretty much means crowdsourcing data from people all over the world, building an international data set for being able to leverage these N-of-1 insights, and then building AI models, algorithms for personalized health optimization, and also learning and discovering more about aging biology to kind of better inform the field and fill in research gaps. How I got into it, my background is in health information management. I was working for ordinary hospital systems, going through diagnosis and procedural coding, all that sort of thing, and just seeing that all of these people were coming into the hospital super sick, leaving in the same condition or perhaps worse, and that there was nothing that I could really do on this other end, just calculating, how much their death and suffering was worth in dollar values. So yeah, I started to really work on true healthcare, which is longevity, and I guess we'll get into more in detail how that kind of came about, but that's what Spark Ventures have always been passionate about, actually making people healthier.
And how? By the way, they each have a really interesting tagline on their website, and your tagline is "A new initiative for ancient ambition." What is the ancient ambition?
Oh, it's living forever, or just living indefinitely. We've heard from ancient times, usually it was the rulers and kings or like some legendary figure, always wants to try and extend their life some kind of way, and now we're in an era where that may actually be possible.
Got it. Okay, I like that. And so, Joe, your tagline on your website is a generational pharma company. So let's hear about your story.
Okay. Well, let's see. How did I get into this? I was trying to figure out what to do after my first company sold to Google, and just like what actually matters in the world? Like how can I actually make a difference? And the conclusion I came to was that I am really crappy at politics, which is why I'm here in Washington. And like most of the suffering around the world that I could see is politics and stuff, like war and poverty, and so I can't do that. But where's the other suffering? And it looked like degenerative diseases were pretty much the rest of it. So that's what I should work on. Okay, how do you do that? Well, it looks like almost all of it derives from aging. So everybody should be working on aging, right? Oh, basically nobody is. Okay, I really need to do that then. It's a pretty simple thought process. And then basically just that's been my entire life ever since like 2009 or 2010. A generational pharma company. Okay, so far pharma has been built on this very sound notion that someone has a disease and you figure out how to cure it. Like you're a doctor, someone walks into your doctor's office and says, I have gout or something, fix it, please. And that's how the whole machine works. And it's been going beautifully for quite a long time, and we have tons of medicines. And our sort of, our healthy lifespan has been increasing impressively. Like quarter a year per year for quite a long stretch. So people on average are living a lot longer than they used to. I don't want to make America the way it was before because people weren't living as long. But there are a lot of things I would like to fix. So if pharma so far has been focusing on waiting for a disease to pop up and then putting it out, fire metaphor, what if some new health-oriented entity came about that was entirely focused on trying to find the root causes of why aging leads to all of these diseases and come up with new targets there? It's a different lens on it, but what that means, even though it's hard, is that there's probably a whole new set of types of medicines that you could create there that should have profoundly powerful, beneficial effects, which means you could probably build an entirely new pharma company on that thesis. So that's what I'm doing.
All right.
Wow, this is going to be a fun panel.
All right, Mac.
Yeah, my name's Mac Davis. I'm founder and CEO of MiniCircle. We make gene therapies for public health. We are using a plasmid platform. It's a circular loop of DNA that expresses for about a year in people. And what got me into this, reaching back in deep, I had a childhood friend with a terminal disease who I loved very much. And then my father was also diagnosed when I became a teenager with this incurable, horrible chronic pain condition, and he wasn't able to get his medication for many years. So this was very tough for me. I was sitting at home just reading on the internet, reading about medicine, these life extension therapies, getting into cryptocurrency, and kind of what I was looking for was some type of information technology that could be intimately transformative and could help everybody, from my dad to my friends and family and everyone in the world. And after many years of noodling around in biotech, after starting my biohacker lab in Austin in 2015, my partner Walter Patterson and I we injected gene therapy plasmid for the first time together back in 2018 and found that it had extraordinary results. And we've been at it ever since, trying out different types of human plasmids. I never thought I would have access to genetic engineering tech, from that early age when I was reading online, like how my friend's condition could be cured. They were like, oh, you could use gene therapy, but that will never be available. So, pretty funny.
And sorry, I didn't say your tagline. Your tagline is actually the clearest tagline, I think, of all the three. It's the world's first reversible gene therapy platform.
Yes.
So I think the word reversible
Yes.
is very interesting there.
I think the reversible part is critical because, number one, the therapy is itself essentially transient. It's only lasting a year. I think there's this safety aspect to it, and this something I like about the wonderful world of digitization is you can, the marginal cost, you can just create a file and then you can delete it. You can try therapy and you can undo it. Traditional gene therapy for all of history in people you get one dose and you're kind of stuck with whatever that dose is. So that makes the pro versus con argument only work for people that have ultra rare diseases and a very severe need. But I'm interested in gene therapies for everybody. And we've been playing with, for the past few years, different types of switches in these plasmids, and we're pretty excited about what's to come.
Great. So clearly these are not, your regular biotech startup companies. Longevity biotech only really became mainstream from my point of view, I don't know, maybe 8 years ago. And you guys are even more radical, right? So how does that impact funding? And how did you raise your funding? Did you have to go through non-traditional sources, and how did all of that work out?
Yes.
Well, you have to say more than that. What did you do?
I decided that I want to go for a really big vision, and I happened to be in the right place at the right time. So I decided that I wanted to build this giant new pharma company, and I happened to be near someone who I ended up getting to know pretty well at a prior gig that I was doing, which was a startup accelerator in San Francisco called Y Combinator, which mostly does tech things. But there was one of the people there running it was Sam Altman, who is also really into bio, because apparently he's made of it. And we wanted to figure out how to do some bio things generally. We tried to get bio happening more at Y Combinator, but it didn't really work that well. And then after I sold my second company, I wanted to do this whole like longevity pharma company thing, and that seems like the kind of swing that he likes to make. Like, what investment could I do? Like, the way I think his mind works is, what investment that I could do if it were successful would make a huge difference in humanity for the things that we're going to need coming up soon. So, like, we're going to run out of energy, and it's destroying geopolitics and all the pollution and the oceans and atmosphere. That's really bad. Like, how about a clean energy fusion company? So he pours like pretty much all of his personal cash into a fusion energy company. That kind of thing. And so, like, longevity also kind of fits that mindset. So that's why I was saying I just happened to be in the right place at the right time. So.
Do you want to say anything more about what kind of pharma company you are? Like, what are you doing?
I mean, right now we are a ragtag team of hardworking, brilliant people in the San Francisco Bay Area of about 65-ish, 63 to 5, constantly increasing number of people who are working on a mission. And the way we state that is that we're adding 10 years of healthy lifespan to humanity. And so it's not based on a specific mechanism or a platform or anything like that. It's more by any means necessary, i.e. what we think are the highest leverage means possible that we have available to us within certain time frames to make a difference in that. So we have a bunch of different things going in parallel.
Okay, got it. All right, non-traditional funding.
Yeah, so we definitely had a non-traditional, and that was that we were 100% funded by cryptocurrency. And this was in March 2023, so a little bit before it got super mainstream. So we were actually spun off of a larger entity called SingularityNet, and also another large player in the decentralized crypto space in the AI. And my co-founder is Dr. Ben Goertzel, who probably many of you know, because he knows like everyone. So yeah, we did the token sale, the RJV token, and that enabled us to build the team and complete our longevity app, which we just launched a few weeks ago. Yeah, and so that was, it's amazing that things like that can happen. And now there's a whole new space in this industry called decentralized science, or DeSci for short. And it's a really exciting space. So if you don't know about it, you should definitely look into that and dive deep, because a lot of emerging biotechs and cutting edge science is now being funded 100% by tokens. So yeah, it's no longer just this kind of fringe or underground sort of a thing. It's a real way to push innovation.
Love that. How about you, Matt?
Yeah, back in 2018, Walter and I were growing like plasmids in oil drums and different glass reactors. And after we did a mouse study and then self-tested the gene therapy, we like less than a dozen people. We didn't tell anybody. We just went to LA this one time, and we're at this deep tech incubator in the art district, and we told some people there what we were doing, and somehow Sam Altman heard about it and was immediately interested. So, our funding journey has been like this. What he told me about funding, I was curious where. For tips, what he told me, I remember, was like, funding is a magical journey with many, many hoops and ups and downs, and it's very difficult to predict. And it sounded like he was talking about playing Candyland. And it's true. I mean, the funding since then has been very much like, oh, this person introduces you to this person, and then that person wants to invest, and it's been a curious venture. I felt very relieved, honestly, that kind of the sparkier or the more riskier, raw, hardcore things that we were doing were actually landing with some of the best funders. So that made me feel safe, I guess. You know, this is what I truly wanted to do. So getting support from others feels amazing.
Okay, so since you brought up the word safe, you're in the biospace. So safety and efficacy, I mean, these are things, no matter how kind of pirate you might be, you still have to come back and make sure that whatever you're creating is safe and works for people. And so if you are sort of in that pirate space, how Navy did you have to get in order to kind of convince funders and other supporters that your enterprise is worthwhile?
Yeah, I guess I can start with that one. Yeah, so it's actually, if you want to be a legitimate company in the crypto space and not just, a run-of-the-mill scammer, there actually is a lot of regulations and legal things that you have to go through. I mean, it's getting better now since it's actually becoming more regulated and having, at least some kind of standardization around it. So, yeah, that's definitely there. And then on the bio side, we're GDPR compliant, working towards HIPAA compliance as well. We're also, so part of our data crowdsourcing is to set up a large observational study, pretty much, database. And so we'll be getting IRB review as well. So we're always kind of staying ahead. I feel like our role is really to bridge the scientific world with the ordinary people, the citizens, the biohackers, as they're called, being able to actually leverage that data and make it useful for the scientific field instead of it just kind of going out into the ethers. It's super important that, we always keep the regulatory things in mind and, stay, pretty much compliant. And of course, informed consent's a big part of that too, since a lot of this has to do with self-experimentation, things that people are doing that may or may not be fully proven safe, effective, et cetera. So we definitely have to stay ahead of that.
You want to go for that?
I think it's really critical to patient choice. A lot of people I see that enter the space kind of have this idea for a radical new drug or gene therapy that they see a path toward developing. Maybe they're from the church lab or whatever, they have the skills to actually make it. And then I think, I see this question on X, on Twitter as well, quite often, like, well, why doesn't this exist? It's clearly implementable. Well, the question is not why doesn't it exist, it's who wants to take it first. The question is like, what is the right group of people to be the first to try on this new therapy, whether it is a disease treatment or curative, or if it's a enhancement or a life extension research thing. Like what people are truly qualified to take on their own informed consent and to join a clinical trial and provide data for something new. I think that's the question and the culture that we need to foster in order to get data from people.
Joe, you want to say anything?
Ironically, we have to play it pretty Navy from the human experimentation side. I mean, we're making fairly invasive drugs and therapeutics, I guess. Like one of ours is a brain injection, for instance. So it'd be a little edgy just to like come over to my apartment and we're going to do brain injections together. I also have this. I have a couple kids, and my youngest is daughter, and I have this heuristic that I play for myself, which I call the daughter test. And then I'm looking at some hoop that a health authority is making us jump through in order to go through all the clinical stages to get our drugs into people. And I'm like, oh, that's really annoying. Do we really have to do that? And then I give it the daughter test in my head. I'm like, if I was, let's say I just happened to be elsewhere, so I didn't get to actually control and do everything myself. I'm on a moon colony or something somewhere. And one of the people at my company was going to be treating my daughter with this brand new medicine that's never been tested before. What tests would I want them to run first, and then how would I like them to conduct this test on her? And like that changes my mind usually. Then I look at this, like, why do I have to test it in rats for 28 days and all this kind of stuff? I'm like, yeah, of course I'd want to test it in rats for 28 days before I test it on her. So that helps a bit.
The daughter test.
The
I
daughter
like
test,
that. Yeah. And so related to that then, how important is it for you all to have, top tier scientific advisors, or can you tell us about, how you assembled your team and like how important it is to have experienced team members? Curious to hear what you think about that.
I think, of course, having the expertise is important for the funding aspect for sure, but then also for carrying it out to completion and development. So one of the aspects that we've done is we've got some medical advisors that actually, tested out in this community ambassador program that involves crypto tokens, our token. And that's really to bridge the clinical space with longevity. And we've talked a little bit about longevity medicine today. So one of my big passions, especially from coming from that space before, is being able to bring this into actual clinical practice and make it less of this kind of woo, extraneous kind of a thing, and just part of basic healthcare. Because longevity itself, it just means living healthier longer, and I think that is what health also means too. So these are synonymous; they're not separate. And so having the clinical leadership actually synergizing with this space is super important. And I hear more and more clinicians actually mentioning holistic medicine and the problem of our system being sick care, and so it's definitely growing in momentum. And same thing on the scientific advisory side as well. You have to start with the right foundations and be able to stay ahead of everything and implement that into the AI models as well, so that we're actually collecting sound data. I know there was mention of dirty data and garbage in, garbage out kind of a thing. So being able to avoid that as well, and put the right paradigms at the core of it. And that's especially important when it comes to something like scaling N of 1 to actually aggregate that for scientific knowledge. There has to be some clear baselines. There has to be some methodology of points of measurement, and then what biomarkers that we actually are measuring, and how to kind of divide that into different strands of like what is going to work best for who, and ultimately lead to people wasting less money and time on things that are not going to work for them. Yeah.
If you're going to be devoting your life to something, you should probably really pay attention to who you're choosing to spend it with. This is usually pretty obvious for people when it's like who they're going to, like, say, build a family with. Although often a lot of very silly choices are made there too. But this is my like primary passion, what I do with all my biological prime time. So it's extremely important to me to do it alongside people who are extremely capable and hardworking and passionate, and I will go to great lengths to find people to work with. Like, for instance, Alex Trapp here, who is a great privilege to work with, and that's like, it's like everything, like who we work with, to me. I have this sign on my desk that says "People are everything," and that's what we spend all day. That's who we spend talking to, working with, getting incredible ideas that we could never have thought of ourselves, from making shit happen. And I also feel that way about advisors. I have a no pretty faces policy for advisors, which basically means that if they want to be an advisor with retro, then they have to actually work. Like, if there are people on there
That's often
just
the problem with advisors.
yeah, I mean, you
they
look at the
just look
advisor
good.
page on,
Yeah.
on a pitch deck or something, somebody's trying to raise money from you, and there's just, you know, a bunch of like, oh, look, you have George Church as an advisor in your company. That's incredible, but like, so do 300 other people. No offense if he's on there, but okay. No, I mean, George is incredible. He's a very brilliant dude who is in it to win it, and has helped an incredible number of people create science that's changing the world, and is like an icon of like first principles thinking and believing we can actually do this.
And he's super prolific too.
Yeah, absolutely.
Compared to other people.
But what I mean is, if you're an advisor, then you should actually be advising us, which means like you should get on like weekly meetings, or just be heavily involved in a realistic way. And so far we have one investor, but Sam's super involved, and I am extremely grateful for that, because his perspective is like weirdly wise beyond his years, and has been very, very useful at many junctures for me.
What do you think, Mac?
Yeah, the advisor question is a juicy one. I feel like there's George Church is a great example. You know, I feel very like conscious of my place in history, and growing up, I always like wanted to meet people like Socrates or you know, different philosophers, different poets I would read. I was like, wow, these are ridiculously awesome people. And, you know, living now and having the chance to meet some of these advisors, it's incredible just to get a sense of their spirit sometimes, and feeling their enthusiasm and support and validation, like, matters a great deal to me. And then there's like another type of advisor that is like working day to day with you, processing these problems, and, you know, literally advising. And oftentimes these people are, you know, maybe don't have pretty faces or are not famous, but wow, you know, I mean, the world is turning around many of these not famous people too, and we just don't know it. So, yeah, those are some of my thoughts on advisors.
Yeah, that makes sense. All right. I have one last quick question, I think, before we open it up to the audience questions. When we were having our pre-call about this panel, one of you said, I hate grants. And that just really surprised me. I'm not sure which one of you it was, but then you all agreed, so it doesn't matter who said it first. Because usually scientists really want grants. They live off grants. Isn't this how science gets created? So I'm curious to hear, if you want to say just really quickly, why you hate grants, and how could things be changed?
Well, actually, I love grants, because I was in a PhD program at MIT, and I was looking at my exemplar, like, okay, this is who I'm going to become, who is Ed Boyle, amazing professor there. And watching him spend his time, it was like more than half of it was grinding away and applying for all these different grants. And I was like, that just looks horrible. I'm out of here. And so I bailed from academia and went into the startup world and never looked back. So I'm really happy about them for that, as an object lesson, I guess.
Wow, I mean, I've heard some grant stories, you know. A fellow person in the life extension gene therapy research community, who I will not name, you know, was like, oh man, Harvard, Rutgers did all these different, you know, grant-supported collaborations with universities, and the universities just live on completely different timelines than startups do. Like, if the startup has to actually finish something, package a product, get to a certain milestone, or else they die. It's just hard to sync those up, and, you know, the grants are they live in this different there's different universes and timelines apparently. I'm very excited about the ARPA-H system though. That sounds pretty cool. That was some of the first grants for broad health span or human resilience initiatives that actually seemed meaningful to this type of mission.
Yeah, agreed.
That was really cool.
Jasmine, you want to?
Yeah, so I'm again going to plug kind of DeSci and Web3 because now there are new methods to get grants. So you don't have to kind of rely on these old traditional systems. If you do have a more adventurous idea or something that might be hard to pitch to them, there's blockchains themselves are doing grants. Like if you build on their chain, there's projects like actually Dr. Ben's SingularityNet project is funding a lot of projects in AI that has to do with humanity and making sure that these new AI systems actually have humanistic values. So there's grants there called Deep Funding to be able to build that platform. So yeah, there's definitely a lot of that's going on in that space too, to be able to get a different type of grant to be able to get started, and it's going really well.
I love that. There's no stopping these people. All right, so questions from the audience? Wow, we've stumped all of you.
Hi. So related to the last question about grants. So everyone has this bad idea of writing grants, but we all need to write grants to get some money, at least somehow. Timelines. So we think grants take a long time, but let's put it into perspective when you first meet a VC versus getting the money. Is there really a difference in timelines?
Okay, so I saw that.
So first date to
Yeah. So
closing deal.
I saw that 50%, and I thought, no way, I don't have to do this. Then I went to Silicon Valley, and it turns out to start a company, you have to go surgically excise a pretty big chunk of time from your brain as a CEO to actually fundraise. But I think the ratio is lower. So it's like maybe every 2 years you go out and fundraise, and it takes you 3-ish months. It's just a better ratio. But it can be kind of a rolling thing for a fundraise, like the very beginnings of it. You're kind of testing the waters and talking to a few people and getting it framed right, and then it tends to hit kind of a crescendo of like the biggest peak of meetings, and then you're essentially done as a company, as the people leaders inside the company within 2 or 3 months. And then lawyers have to do some sort of dot I, cross T kind of stuff for another few weeks after that. But it doesn't, like the point of which my brain is completely offline from building in the company kind of ends then pretty much.
Yeah.
Plus, when you're raising money, when you go out and you pitch all these people, you get money from more than one source, presumably at that point. Versus when you're applying for grants, it's usually like this one big grant, and so you're putting all your eggs in one basket.
I've tried applying for grants. I've tried crowdfunding. I've tried nonprofits before, and I was completely astonished by the VC world. Like, you can have a face-to-face or a Zoom meeting with somebody. They make a decision almost immediately, and you get the money or you don't. It's astonishingly time-saving. I was very impressed with the process, actually.
Anyone else?
I don't know if anyone has experience on the panel here, but I also noticed that this is very different depending on different agencies of the government, right? So I won't name any, but I've had experiences where I've been trying to get a grant for 2 years for something, and I've had other experiences in different agencies of the government where it's just like a handshake in 2 days. So I think maybe there's something to discuss here about, there's alternative models that have been launched as well, some on the DeSci side, Jasmine. So I think there's intellectual power that could be put to analyzing all of these different traditional and alternative granting mechanisms and see if there's ways that we can develop sort of a new way that gets the best, all the positives but none of the negatives. Again, this is something that we're working at the Lifespan Research Institute. It might have something to announce in the next couple of months, but if anyone wants to talk about this, but I'm just curious if you have experiences like me in that it's very different in different sort of departments or agencies.
Well, one cool innovation is that you can do milestone-based grants, and that's kind of a model that's emerging in Web3. Is basically, you get a certain amount deployed for stage one, and then once you meet that, then you get the next stage of it, and it just keeps piling on like that. So it's kind of a back and forth proof of delivery kind of thing. And then, of course, smart contracts and borderless currency, it can deploy to the person immediately, and there's kind of a structure around it, so there's no kind of waiting around for any indefinite periods of time.
I think with that, we've just hit our time. So we'll thank you, everyone.
Thank you.